The stethoscope slipped from Dr. Marcus Williams' hands and hit the hospital floor with a metallic clang as the head nurse looked him dead in the eye and said, "You need to leave this area right now. This is for medical personnel." Only the cardiac monitor was screaming in the background. A patient was dying, and Marcus, a board-certified emergency physician with 6 years of experience, was being told he didn't belong in his own hospital. Welcome to Voice of the Black, where we share the untold stories that reveal the truth about what it means to be black in America. Before we dive into this incredible story that will leave you questioning everything you think you know about racism and healthcare, tell us in the comments what city you're watching from today. And if you believe that judging someone by their skin color instead of their qualifications is wrong, hit that subscribe button right now and join our community who refuses to stay silent about these injustices. It was 2:47 a.m. on a Tuesday night at Chicago General Hospital, and Dr. Marcus Williams was exactly where he was supposed to be. The emergency department was quieter than usual, just the hum of machines and the distant sound of someone coughing in room 3. Marcus had been working the night shift for 8 months now, not by choice, but because it was the only position available when he finished his residency at Northwestern Memorial. The hospital administration had made it clear that day shifts were reserved for doctors with more seniority, which seemed to coincidentally be all white doctors. But Marcus wasn't complaining. He was grateful to have a job at all, even if it meant working when most of the world was asleep. Marcus was tall and lean, with close cropped hair and hands that never seemed to stop moving. He had the kind of quiet confidence that came from years of studying, memorizing, and proving himself over and over again. But confidence meant nothing when people looked at him and saw everything except a doctor. He wore his white coat, like arm of the pockets filled with medical instruments and notes from his last patient. But somehow it never seemed to matter what he wore or how he carried himself. There was always someone ready to question whether he belonged. The emergency department at night was a different world. Fewer administrators, fewer witnesses, just the core medical staff trying to keep people alive. Until morning, Marcus preferred it that way, less politics, more medicine. But tonight would test every ounce of patience he had built up over the years, because sometimes the worst emergencies weren't the medical ones, they were the human ones. Nurse Jennifer Morrison was working the central station when the call came in. She was 42 years old with 15 years of experience and a reputation for running a tight ship. She took pride in her work and her department, but she also had opinions about who belonged where, and those opinions have been shaped by 30 years of living in the same neighborhood, going to the same church, and rarely questioning the assumptions she had grown up with. When she saw Marcus walking toward the trauma bay, her first instinct wasn't to ask what he needed. It was to assume he didn't belong there. The ambulance doors burst open at 3:15 a.m., and everything changed. The paramedics were shouting over each other as they wheeled in a 60-year-old man who had collapsed at a construction site, cardiac arrest, no pulse for 12 minutes. They had managed to get a rhythm back in the ambulance, but was weak and fading fast. This was the kind of case that separated real doctors from everyone else, the kind that required split second decisions and flawless execution, the kind that Marcus had trained his entire life to handle. Marcus heard the commotion from the break room where he had been reviewing charts and immediately moved toward Trauma Bay 2. He could hear the paramedics rattling off vitals and medications as they transferred the patient to the hospital gurney. But before he could reach the bedside, Nurse Morrison stepped directly into his path with her arms crossed and her voice sharp enough to cut glass. "Excuse me," she said, "you can't be in here. This is a restricted area." Marcus stopped, blinking in confusion. Dr. Williams supposed to be here?" Morrison looked him up and down, taking in his white coat, his ID badge, and his stethoscope, but somehow seeing none of it. "I don't know who you think you are, but this is an emergency situation. We need real medical personnel only." The words hit Marcus like a physical blow. Real medical personnel. He had heard variations of this his entire career, but never so directly, never so boldly. He pulled out his hospital ID and held it toward her. "This is my ID. I'm the attending physician on duty tonight." Morrison barely glanced at the card. "IDs can be faked," she said. "Maintenance workers have been caught trying to sneak into patient areas. Before you're going to need to wait outside while the real doctor handles this." Behind them, the patient was deteriorating. Marcus could hear the monitors changing pitch, the subtle shift that meant they had minutes, not hours, to save this man's life. But Nurse Morrison was still standing in his way, still questioning his right to do the job. He had spent 12 years training for the job. He was legally and medically qualified to perform the job that nobody else in this hospital was currently available to do. "Listen," Marcus said, trying to keep his voice calm and professional. "There seems to be some confusion. I'm Dr. Marcus Williams, the first completed my residency at Northwestern. I have been working in this department for 8 months. I am the only emergency physician on duty right now. And that patient needs immediate medical attention." Morrison shook her head. "You can keep saying it, but that doesn't make it true. I've never seen you before, and trust me, I know every doctor in this hospital." That was the moment Marcus realized what was happening. Morrison had been working nights for over a decade. She had seen him dozens of times, but somehow her brain refused to process the information that a young black man in a white coat could actually be a doctor. She had seen him walk in halls, checking on patients, writing orders, but she had categorized him as something else: maintenance, security, maybe a medical student, but never a real doctor. The patient monitor started beeping faster, indicating ventricular tachycardia, a potentially fatal heart rhythm that required immediate intervention. Marcus could see the EKG readout from where he stood and knew they had less than 2 minutes to act, but Morrison was still blocking his path, still insisting that he didn't belong there, still waiting for a real doctor to arrive. "Dr. Williams, where are you?" The voice came from Trauma Bay 2, where Dr. Patricia Chun, the night shift internist, was calling out. Marcus could hear the urgency in her voice. She knew the patient was critical, and she knew she wasn't qualified to handle advanced cardiac life support on her own. She needed the emergency physician. She needed Marcus. "That's me," Marcus called back. "I'm right here, but I'm being prevented from entering the Trauma Bay." Dr. Chin appeared at the doorway, her scrubs already splattered with evidence of the resuscitation attempt. "Marcus, thank God you're here. I need you right now. This patient is in VTACH, and I can't get him converted." Morrison looked back and forth between Marcus and Dr. Chun, her face showing the first crack in her certainty, but she still didn't move. "Wait," she said to Dr. Chun. "He's claiming to be a doctor, but I don't think." Dr. Chin stared at Morrison like she had just spoken in another language. "Jennifer, what are you talking about? This is Dr. Williams. He's been working here for months. He's our night attending." The confusion on Morrison's face was almost comical if the situation hadn't been so serious. She looked at Marcus again, really looked at him for the first time, and Marcus could see the exact moment when her preconceptions crashed into reality, when her assumption that black men couldn't be doctors met the undeniable fact that this particular black man was not only a doctor, but the most qualified person in the building to save the dying patient's life. I didn't," Morrison started to say, but Marcus was already moving past her toward the Trauma Bay, where every second of delay meant a lower chance of survival. The patient was a construction worker named Robert Martinez, 58 years old, father 3, who had been working a double shift. When his heart decided to stop functioning, Marcus took one look at the monitor and knew exactly what needed to be done. He had seen this rhythm pattern dozens of times and had successfully treated it more often than not, but success required immediate action and absolute precision. "We need to cardio over it right now," Marcus said to the team as he moved to the head of the bed. "This rhythm won't respond to medication alone." Dr. Chin nodded with relief, finally having someone who knew what to do, but the rest of the nursing staff seemed frozen, not because they didn't know the procedure, but because they were still processing what Morrison had tried to tell them, that the black man they had assumed was maintenance was actually the doctor they needed to save their patient's life. Marcus could feel the weight of their stares, the questions they weren't asking, the assumptions they were reconsidering, but he pushed all of that aside. Because Robert Martinez didn't care what color his doctor's skin was. He just wanted to live to see his family again, and Marcus was going to make sure that happened. "Charge to 200 joules," Marcus ordered, and the room snapped into action. The defibrillator hummed as it charged, and Marcus positioned the paddles on Robert's chest. "Everyone clear," he called out, and the team stepped back to shock, deliver a controlled burst of electricity that reset Robert's heart rhythm, like hitting the restart button on a computer that had frozen. The monitor showed normal sinus rhythm, and Robert Martinez took his first real breath in 20 minutes. The trauma bay went quiet except for the steady beat of the heart monitor, showing a strong, regular rhythm. Marcus checked Robert's pulse, blood pressure, and neurological responses. Everything looked good, better than good considering how long he had been down. They would need to run more tests and monitor him closely. But the immediate crisis was over. Robert Martinez was going to live. Dr. Chen was the first to speak. Marcus, that was incredible. I've never seen someone work that fast. Marcus nodded, but his attention was still on the patient, making sure the rhythm stayed stable, making sure there were no complications from the cardioversion, making sure he had done everything possible to give Robert the best chance at recovery. It wasn't until 15 minutes later, when Robert was stable and admitted to the cardiac ICU, that Marcus finally allowed himself to think about what had happened in those crucial moments when Morrison had tried to prevent him from doing his job, when she had questioned his qualifications based on nothing more than the color of his skin, when she had been willing to let a patient die rather than accept that a black man could be a doctor. Morrison hadn't left the trauma bay. She had stayed in the corner, watching as Marcus worked, watching as he saved a life with the kind of skill and expertise that comes from years of training and experience, watching as every assumption she had made about him crumbled into dust. After the patient was transferred, Morrison approached Marcus slowly, like someone walking toward a dangerous animal. "Dr. Williams," she said quietly, "I owe you an apology." Marcus looked at her, his face showing none of the anger he felt inside, just a tired sadness that came from dealing with this kind of ignorance his entire career. "An apology," he said, "would be nice, but what I really need is for this to never happen again." "I don't understand," Morrison said. I know I made a mistake, but..." Marcus interrupted her. "You made a mistake that could have killed a patient. You saw a black man in a doctor's coat, and your brain decided that was impossible. So you nearly prevented me from saving someone's life." Morrison looked down at her feet. "I didn't mean to." "Intent doesn't matter," Marcus said. "Results do. And the result of your assumptions was that Robert Martinez almost died while we argued about whether I was qualified to save him." The conversation was interrupted by Dr. Patricia Chan, who had been listening from the doorway. "Jennifer," she said to Morrison, "I need to talk to you outside right now." Marcus knew that conversation would involve words like bias training and possible disciplinary action, but he wasn't particularly interested in Morrison's fate. He was more concerned with the pattern he had observed during his 8 months at Chicago General, the subtle ways that his competence was questioned, his orders were double-checked, his presence was explained away. This wasn't the first time someone had assumed he didn't belong. It happened with patients who requested a different doctor when they saw his face. It happened with administrators who spoke to him like he was a medical student, even when he corrected them. It happened with other doctors who seemed surprised when he demonstrated knowledge they hadn't expected him to possess. But tonight had been different, because tonight someone's life had hung in the balance, and racism had nearly tipped the scales toward death. The rest of the night shift passed quietly. Robert Martinez remained stable in the ICU, and Marcus handled 2 more cases of broken arm from a late-night basketball game and a case of food poisoning from a questionable seafood restaurant. But his mind kept returning to those moments when Morrison had blocked his path, when she had been so certain that he couldn't possibly be what he actually was. At 6 a.m., when the day shift arrived, Marcus was finishing his notes when Dr. Sarah Peterson, the day attending physician, stopped by his desk. "Heard you had quite a night," she said. Marcus looked up. Peterson was one of the few doctors who had treated him as an equal from day one, who had never questioned his credentials or his competence, who seemed genuinely puzzled by the way others reacted to his presence. "Robert Martinez is stable," Marcus said. "She'd make a full recovery." Peterson nodded. "That's not what I meant. I heard about the situation with Morrison." "Word travels fast," Marcus said. Peterson sat down across from him. "Marcus, I want you to know that what happened tonight was completely unacceptable, and there will be consequences." Marcus appreciated the support, but he had heard similar promises before. Consequences tended to be light when it came to racial bias training sessions and stern conversations that changed nothing about the underlying attitudes. "What I really want," Peterson continued, "is for you to know that you belong here. You're an excellent physician, and this hospital is lucky to have you." Marcus nodded but said nothing, because while he appreciated Peterson's words, he knew that belonging wasn't something that could be declared by well-meaning colleagues. It was something that had to be earned over and over again every single day in the face of people who would always see his skin color before his stethoscope. 3 days later, Marcus was working another night shift when he got called to the emergency department for a cardiac emergency. The patient was a 45-year-old woman who had collapsed at home, and her husband had called 911. When Marcus walked into the trauma bay, he found the same team that had been there for Robert Martinez, including Nurse Morrison. Morrison saw him coming and immediately stepped aside. Dr. Williams. She said the patient is in atrial fibrillation with rapid ventricular response. She needs cardioversion. Marcus was surprised by the change in Morrison's attitude, but he focused on the patient, a teacher named Linda Hayes, who was conscious, but clearly in distress. Her heart rate was over 180 beats per minute, and she was having trouble breathing. Mrs. Hayes, Marcus said, as he approached the bedside, Dr. Williams, I'm going to take care of you. Linda looked at him with frightened eyes. Doctor, she said, please help me, I can't breathe. Marcus could see the fear in her eyes, but also something else, relief that a doctor was finally there to help her. She didn't question his qualifications or his appearance. She just wanted someone to make the terrible feeling in her chest go away. The cardioversion worked perfectly. Linda's heart rhythm returned to normal within minutes, and she was able to breathe normally again. As she was being prepared for transfer to the cardiac unit, she grabbed Marcus' hand. Thank you, doctor, she said, you saved my life. Marcus squeezed her hand. Gently, you're going to be fine, Mrs. Hayes. After Linda was transferred, Morrison approached Marcus again, but this time her demeanor was completely different. Dr. Williams, she said, I want to thank you for what you did the other night with Mr. Martinez. Marcus looked at her, waiting for her to continue. I also wanted you to know that I've been thinking about what you said about bias and assumptions. Morrison continued, I've signed up for some training courses, and I've been trying to examine my own reactions. Marcus nodded. That's good, Jennifer, but the real test isn't in training courses. It's in moments like these when someone needs help, and you have to decide whether to see them as human first or as a category. Morrison seemed to consider this. You mean like how Mrs. Hayes just saw you as a doctor who could help her? Exactly, Marcus said. She didn't care what I looked like. She just needed someone who knew how to fix her heart. Over the following weeks, Marcus noticed small changes in how he was treated at Chicago. General Morrison went out of her way to be supportive, and professional other nurses began asking him medical questions. Instead of assuming he wouldn't know the answers, patients seemed more relaxed when he introduced himself as their doctor. But the real change came 6 months later when Marcus was offered position on the day shift. The hospital administration had decided that his skills were too valuable to hide on the night shift. They wanted him visible during regular hours, working with the full medical team, handling the most complex cases. On his first day on the day shift, Marcus walked into the emergency department at 7 a.m. to find a full staff of doctors, nurses, and medical students waiting for morning rounds. As he joined the group, several people welcomed him with genuine warmth, but he also noticed a few faces that showed surprise or confusion, people who hadn't expected to see him in this role at this time. Dr. Peterson introduced him to the group as the new day attending, and Marcus could feel the shift in energy, some positive, some uncertain, but all paying attention. The first case of the day was a 70-year-old man with chest pain and shortness of breath, classic symptoms of a heart attack. As Marcus examined the patient and reviewed his EKG, he could feel the medical students watching him carefully, taking notes not just on his medical decisions, but on his presence as a black doctor in a position of authority. Mr. Johnson, Marcus said to the patient, you're having a heart attack, but we're going to take excellent care of you. The patient looked up at Marcus with complete trust. Doctor, he said, do whatever you need to do. As they wheeled Mr. Johnson to the cardiac catheterization lab, Marcus reflected on how much had changed since that night with Robert Martinez, when Morrison had questioned his right to be there, when assumptions about race had nearly cost a patient his life. The medical students followed Marcus to the next case, asking questions about treatment protocols and diagnostic procedures, treating him exactly as they would any other attending physician, learning from his expertise without questioning his qualifications. During lunch break, Marcus sat with Dr. Peterson and several other colleagues discussing challenging cases and new medical research. The conversation flowed naturally, with Marcus contributing insights and recommendations that were received with respect and consideration. You know, Peterson said to Marcus, I think having you on the day shift is going to change things around here for the better. Marcus smiled, I hope. But change has come from everyone recognizing that competence doesn't have a color, and that assumptions can be dangerous. That afternoon, Marcus was called to consult on a complicated case in the ICU. When he arrived, he found a family gathered around the bed of a young woman who had been in a serious car accident. The patient's mother looked up as Marcus entered the room. "Are you the doctor?" she asked. "Yes, ma'am," Marcus replied in Dr. Williams. The mother stood up and took his hands. "Doctor, please tell me my daughter is going to be okay." That evening, as Marcus finished his shift, he received a call from Robert Martinez, the construction worker whose life he had saved that chaotic night. Dr. Williams, Robert, said, "I wanted to thank you again for what you did. My daughter is getting married next month, and I'm going to walk her down the aisle because of you." Marcus felt a warmth in his chest that had nothing to do with recognition or vindication, and everything to do with the reason he had become a doctor in the first place: to heal people, to save lives, to make a difference regardless of what anyone thought about his appearance. As he drove home that night, Marcus thought about all the patients he had treated, the lives he had saved, the families he had comforted, and he realized that every single one of those moments had been worth the struggles, the assumptions, the barriers he had faced. Because at the end of the day, medicine wasn't about the color of the doctor's skin. It was about the skill of their hands and knowledge in their mind and compassion in their heart, and Marcus Williams had all three in abundance. The story of Dr. Marcus Williams reminds us that competence has no color, that assumptions can be deadly, and that sometimes the person who looks least likely to save your life might be exactly the person you need. Never judge a book by its cover, because you might miss the most important chapter, and never let prejudice prevent you from recognizing excellence when it stands right in front of you.